Hi guys, this is my 28 and 29 week update. Major developments for the baby this week. Very exciting. The baby's about 2.5 pounds, the size of a butternut squash or a small cabbage head. And the baby's five senses are almost fully developed, and the baby also has a stage of sleep that it experiences called REM sleep, which stands for rapid eye movement. And from adults, we know that REM sleep is the stage in which we dream. So babies within, like in utero, experience REM sleep, which I didn't know until I read my app, and I was like, wow, that's really cool. So those are some of the major developments for the baby. Um, Now, this last week, actually 29 weeks today. So last week, I got a call from my OB saying I had a lot of bad news actually. So first thing she said is that my glucose screening test results came back and I had a level of 8.9. They like to see 7.7, so I need to go in for now the glucose tolerance test, which is 3 hours long. The first one was 1 hour long. So not looking forward to it. I just hope that I do not have gestational diabetes. So I've cut out fruit, very sugary fruits, and I'm eating lots of vegetables, lots of whole wheat stuff, and just really trying to change my diet before I go in for the tolerance test. And I plan to keep my diet that way uh, until I deliver. Second thing she told me was that my blood type was O negative, so that I need the RhoGam shot. Now here's the thing. All along, prior to my pregnancy, I used to donate blood. I know that I am O positive. And even early in my pregnancy, during my bleeding that you all know about, during, I think it was week 3, the ER department I went into typed me as O positive. So I knew I was O positive, and this was really confusing to me. So I typed my blood again. With my GP, and it came back O positive. So only my OB was telling me that I was O negative, and I did that blood work in a different lab in the hospital. This has been really stressful for me because I need to get the RhoGam shot if I am Rh negative, and if I'm not, then I don't need it. And I don't want to take the shot if I don't need it. So I've really been trying to reach out to some hematologists and some blood transfusion specialists who have been kind enough to explain that I might be a weak D, and a weak D means that sometimes some labs who test can show you you as O positive, whereas others can show you as Rh negative. Sorry, I keep saying O. O is my blood type, but Rh is what we're talking about, the D antigen. If you're positive, you have the antigen, and if you're negative, you don't. So I'm a weak D, so technically I am positive, but I've been doing a lot of research on this, and there are various types of weak Ds, and some weak Ds don't produce antibodies, whereas some do, in the face of when their blood mixes with O negative, O positive. So it's just, I'm still in the phase of figuring it out. I've given my blood for genotyping, so that's going to tell me exactly what variant I am. So I'm waiting to find out the results. Now, another thing my OB told me on the phone that day is that I had a yeast infection and that I could buy over-the-counter meds and get it resolved. Now, when I went to do my blood test again to find out what blood type I am, just for, my peace of mind, my GP did urine analysis as well. And it came back saying that I have group B strep, that I'm positive for group B strep. So it's showing up in my urine, but the group B strep test is not done until you're 35 to 37 weeks, and it's done with a swab. a vaginal swab and a rectal swab. And so my OB is not really too concerned about it being in my urine, but this is kind of really scaring me. And I read up on how to get rid of group B strep naturally. And it says to eat a lot of yogurt, a lot of probiotic stuff. And to eat whole garlic, which I did for a while, and then I read that garlic can induce contractions, so I stopped with the raw garlic, but I do have probiotic yogurt every day. And lots of vegetables too. So I'm hoping that when I do get tested again, I'm not going to be group B strep positive anymore, because that means I need to be on antibiotics as soon as I go into labor. Otherwise, it's very problematic for the baby. It could be very harmful, even though the chances are small. If the baby is affected, it's extremely detrimental. So, yeah, lots of bad news. I really have been a mess actually with all the stress that I've been going through. And I'm just really hoping that today I have an appointment with my OB, so I'm hoping that I get some answers today. And yeah, so I went to a prenatal class with my husband this weekend, and I learned a lot about, labor, early labor, second stage of labor, what kind of pain management you can use. Obviously, epidural being the most common, but the nurse told us that there's also the option of using laughing gas, and it's self-administered. So as you're in labor, they give you nitrous oxide that you can just put on like a mask, and you self-administer it. I don't think I'll be doing that because it does pass the placenta and could affect the baby. So epidural is probably the safest. And yeah, she also taught us breathing techniques and just the basics of breastfeeding. I thought it was a useful thing. So, ladies, go to a prenatal class, especially if one is offered at your hospital, because I got a tour of the hospital, so I know exactly where things are. And yeah, that's the update for this week. I know it's not a happy one, but I'm just, I just hope that everything does work out, and I will definitely keep you guys posted about this changing RH factor confusion and also about my group B strep status. I hope everyone out there is doing well.